Welcome to this video. Today we will be addressing an issue with the classification of symptoms in mental diagnosis. Mental health diagnostic criteria have long been criticized for being based on male-centered research samples, androcentric, leading to significant gender biases in the classification and treatment of mental disorders. Historically, psychological studies and clinical trials have primarily used male participants, resulting in diagnostic tools reflecting male-presented symptoms while often overlooking how the same conditions may differ in women. One of the key issues is that many diagnostic criteria are based on external symptoms, which are more commonly exhibited by men. For example, ADHD has traditionally been associated with obvious hyperactivity and disruptive behavior, which are more frequently seen in men. However, women are more likely to internalize symptoms, displaying them through social withdrawal, anxiety, or perfectionism, which are often overlooked in diagnosis. As a result, many women do not receive correct diagnoses until adulthood. Furthermore, depressive and anxiety disorders, which are statistically more common in women, were once considered hysteria or emotional instability rather than medical conditions. A major reason for this is that women tend to be better at masking their symptoms. Masking refers to the conscious or unconscious suppression of symptoms to fit social expectations. Women are often socialized from an early age to mimic appropriate social behavior, making their symptoms less explicit to mental health professionals. Therefore, the consequence of this gender bias in mental health diagnosis is that many women suffer in silence, struggling without proper support or treatment, or even possible misdiagnosis. It's not all bad. There are several things that can be done to ensure an improved diagnostic criterion. These can include more gender-inclusive research samples, revised diagnostic guidelines to be inclusive of masking behaviors, and greater awareness of gender differences to avoid beta bias. These strategies can ensure more accurate, fair, and effective diagnoses and treatments for all individuals, regardless of gender.